welcome back. Again, my name is Dr. Andrew Gorecki, and hopefully you are finding value on the course so far. In this video, we're talking about how to understand back pain better. And I think by understanding back pain better, that means you need to understand all that can go wrong, and so that you can start to understand yourself better. So we're going to cover the common causes of back pain and really just understanding back pain in general here. Before we start to get into ways to test ourselves and come up with solutions, we need to first understand all the possibilities. So when I have years and years of experience, 10 years helping people with back pain. I've been studying this for 17 years. I myself have had major back pain and problems. And so when I'm talking to you in this class and we start to talk about the types and understanding back pain, I'm using what's called the 80-20 rule, meaning for every person I see with back pain, 80% of the time it's 20% of the possibilities. And that's actually a law called Pareto's law. So the 80-20 rule. It means I can speak to a larger group of people about back pain, knowing that most of the time it's 20% of the possibilities. So we're going to cover from that perspective. And so most of the time when I see people with back pain, this is what we're talking about. So it's first important to recognize that the body heals itself naturally. I don't heal people. There's no magic pill that heals back pain. There's no magic device that heals back pain. The thing that heals back pain is the body. The body heals itself naturally. However, it needs the right environment to do so. And so that environment is just like a plant, right? A plant needs to have soil for nutrition. It needs to have sunlight, and it needs to have CO2 or carbon dioxide in order to thrive. And if any one of those three things for a plant is out of whack, then the plant will not grow and it will die. Back pain is the same way. The human body needs to have sleep. Sleep is the only time our body heals itself through the REM cycles. We get 3 to 4 90-minute REM cycles a night. So if you're not sleeping enough, that's one piece of the puzzle that needs to be addressed. Number 2 is you need to have proper nutrition and hydration. So if you're not eating the right foods, you need to eat foods that are, real foods. So basically anything in a bag or a box I would throw out and eat things that are natural. Vegetables, fruits, meats, nuts, legumes, things that have high nutrition density so your body gets the right fuel to heal itself. So sleep, nutrition, and hydration. So water is a big element of this. So water is 88% of our body, and we are going to start to talk about how it's a movement-based problem in the body that's actually causing back pain. And so you need hydration to move. Hydration allows for our body to be more fluid, and it also helps the healing process. And then number 3 is you need to have a physical environment that allows for healing. So if you remember before, I talked about the 2 types of injuries. An acute trauma, day 1, you had an accident, something happened, and then as time goes on, that injury heals itself because the thing that was causing the trauma is gone. However, most back pain is what's called a cumulative trauma injury, meaning there's something moving improperly in your body, and as time goes on and the more you move improperly, it wears your body out and the trauma accumulates. So in that scenario, the thing that's causing the trauma or the physical stress is still there and it's accumulating over time. That's a scenario where the body can't heal itself because the stress is outweighing the body's ability to repair itself. And so we're going to talk about how to remove that stressor, that physical stressor in those cumulative trauma disorders that is back pain. But it's important to recognize that the body does heal itself naturally, but you have to create the right environment. I'm not going to spend a ton of time talking about sleep and nutrition and hydration, but there's plenty of resources out there. But the bottom line is you need to have good sleep, 8 hours of sleep a night, where you're getting restful REM sleep, and you need to have hydration, which is basically you need to drink as many ounces a day as your body weight. So if I'm 200 pounds, half your body weight in ounces. So if I'm 200 pounds, I need 100 ounces a day of water. It's a lot of water. And then, of course, food, and so you can find those resources. All right, so let's get into the 3 types of low back pain. And when I say types, that's the name, or I don't want to use the word diagnosis, but oftentimes referred to as a diagnosis. But it's basically how we label it. What do we call it? It doesn't mean it's the cause. So the first thing that I see commonly with people that have back pain and also pain that travels down the leg is sciatica. And so sciatica really it's a name, and it's referencing that this nerve, you can see that this big nerve, it's about the size of your thumb, comes out of your pelvis through a hole, and it travels down your leg to your toes. That nerve carries a lot of important signals. It carries signals down, and it also carries signals up your spinal cord into your brain. Things like pain, temperature sensation, pressure. It sends signals to your muscles so they can function, so there can be strength. It sends signals from the muscles up to the brain that tell your body where it is in space. They're called proprioceptors. But again, sciatica means that, and again, these nerves, they come from the lumbar segments. You can see up top here. See, they exit out of a hole coming out of the spine at levels 1 through 5. And those small nerves, called nerve roots, come down and join forces right in here to create a big sciatic nerve. And so when that sciatic nerve, excuse me today, ooh, I have to go back and edit that out. I've got a little cough today, sorry. When we look at anywhere the sciatic nerve is irritated, being compressed mainly, it could be compressed coming out of the hole from the spine through stenosis or disc bulges or herniations. It can also be compressed through any muscle that it passes by. So in this area, it passes through a lot of hip muscles, glutes and piriformis. But essentially, when that sciatic nerve is irritated, it's called sciatica. And the symptoms of sciatica would be pain that travels down the leg. Typically, if it's sciatic nerve, it's in the back of the thigh. Excuse me, I'm eating a cough drop. So if we've got pain that travels down the back of the leg, we've got numbness and tingling in the back of the leg. And also sometimes if it's compressed enough, we'll get weakness in the leg. And so those can be symptoms of the sciatic nerve. Sciatica really isn't a type of back pain. It's just a type of symptom, actually. But it's most commonly written down on a piece of paper when someone's got back pain. And you can see here, this is the path. If you've ever had it before, I've had this before, not a fun sensation. I had this for over a year, but it really feels like a hot poker that travels down the path of that nerve, all the way down to your toes in some cases. So the symptoms of sciatica, the severity is measured by how far down the symptoms travel. So if the symptoms only travel down to your knee, that's not as bad as if they travel down to your calf, which is not as bad as if they travel down to your toes. You can have no back pain at all and only sciatica. That's definitely a symptom of some people. But I would say that there's many causes of sciatica, and we'll get into those. Next up is what's called a herniated disc or a bulging disc. Very similar. A bulging disc is a herniated. They're the same thing, except a bulging disc is a progressed hernia. It's a progression. The herniated disc is a progression of a bulge disc. And then sacroiliac pain or SI pain. So these are the top 3 most common causes. 80% of the time, it's either a bulging disc. I said causes. I should have said types. I'm sorry. The types. 80% of the time, it's herniated disc or bulging disc, sacroiliac pain, which is short for SI pain, or stenosis, which is the Latin word for narrowing. It also is the same, has other names called like arthritis, degenerative disc disease, things like that. We'll get into each one here individually. So let's talk about herniated discs or bulging discs. So what is it? Well, again, it's one of the most common types or names of back pain. And you can see here that we've got this bony segment. This is a vertebrae in the spine. And then you've got another vertebrae that it stacks on top of. Right here, the white part is actually the joint where the movement occurs in the spine. But in the middle of these two bones is this material in here called the disc. And in somebody who's 25 years old, this disc material feels like crab meat. And as we age, it gets dehydrated. And when we're in our 70s and 80s, it feels like a leather belt. So a lot less movement as we get older, as well as space because it loses hydration. It becomes essentially old and wrinkly like our skin. This disc has a outer ring, which is like a fibrous material. And then the inside is the softer material with more hydration. So we know that a bulge looks like this right here. So a bulge is going to occur when this area in between these two bones has to move too much. It has too much physical stress and it causes this to bulge out. If this bulge becomes moved enough, it will actually cut this outer fibrous material in the inside. The crab meat material, if you're younger, will shoot out and actually push out farther. And then you can see that you can have a disc bulge technically anywhere along this ring, but if it happens to be either straight back or what's called posterior lateral, which is kind of back but to the side, it can push on this nerve right here. And again, this nerve is one of the nerve roots that joins the sciatic nerve. And so when you look at the sciatic nerve, the pathway that you're having the pain or the numbness and tingling or the weakness in the leg will help you understand which one of these nerves is being compressed. So for example, if this was L1, the top of the lower back, the L1, L2 vertebrae nerve, you would have pain traveling down the front of your thigh. If it was L5, it'd be the back of your thigh and to your calf and your big toe. We'll get into that at some other point. So symptoms would be, most commonly, the symptoms are actually in somebody who's under the age of 35. So it discriminates by age. The pain increases typically with bending forward, coughing, laughing, or sneezing. The coughing, laughing, or sneezing increases the pressure inside here, which causes this to push out farther. The same thing with bending forward. So bending forward would make the pressure increase in the disc bulge area and push out farther. That's an important differentiator though, because when you bend forward, it opens up these joints. So the joint space increases. So when you bend backwards, the joint space decreases. And that's a way to rule in or rule out. Is it a disc that's causing the symptom, or is it the joint itself that's causing the symptom? Typical symptoms of this scenario would be sciatica. So sciatica is a symptom of a disc bulge or herniation. And the symptoms would be pain, numbness and tingling, weakness down the back of the leg. So we know that studies show that 2/3 of disc bulges and herniations heal on their own, oftentimes within a few months. 85% of them heal with conservative physical therapy. The main cause of the type of back pain, which is a disc bulge or herniation, is excessive motion in the disc. So the disc moved more than what it was supposed to move, or it had too much weight, too much load during the movement, which caused the disc to displace or tear, which then led to a disc bulge or herniation. So the appearance on imaging, if I had an x-ray, and really in this case it'd be an MRI. If I had an MRI, because it's soft tissue, the appearance of disc bulges and herniations on an MRI increases with age. Yet, most of the images that are done that show a disc bulge or herniation are asymptomatic, meaning they don't have pain. Here's my evidence. This is from an asymptomatic imaging study looking at thousands. This is actually a systematic review, so it was looking at many studies. Very high level of evidence here. And you can see at the age of 20, a disc bulge was shown up 30% of the time in pain-free 20-year-olds when given an MRI, and 29% of the time it was a herniation or protrusion, but yet they're pain-free. And you can see as you go up to age 30, 40, 50, 60, 70, the percentages just keep increasing. And these are pain-free people. So my caution would be that you don't need to have an MRI when you have a disc bulge, a herniation, or sciatica. Remember that we talked about the red flags that would indicate you need an MRI, which would be changes of bowel and bladder symptoms. So if you lose control of your bowel and bladder, if you have weakness, significant weakness in a leg or an arm, you suspect a fracture because you had an acute trauma, and you suspect infection. Other signs of infection would be a fever. And otherwise, you don't need one, because if you get one, if you're, say, 40 years old, there's a 50% chance it's going to show one regardless of whether you have pain or not. And so what ends up happening when we get one is that it leads us down the path of surgery more often, and oftentimes we know we can resolve the symptoms without surgery. So the solution to a disc bulge or disc herniation we'll get into later on, but really the simplistic way of thinking about it is that the solution is found by reducing the motion in that particular area that's bulging or herniating. And so since we can't technically do that by just holding on to it with a brace, or what the strategy needs to be is increasing, since the whole body moves together. Every time we move our body, everything moves. So when you turn your head left and right, there's motion happening down in your lower back and in the discs. The strategy needs to be in increasing the motion in the surrounding areas so that when you do move, there's less demand or motion that needs to happen in the area that's injured, right? So stabilizing by increasing motion above and below. We'll get to that later. Again, improving the motion in the areas above and below. Let's talk a little bit about sacroiliac pain, or SI pain. So really what that means is when this is the sacroiliac joint, where the sacrum, which is the bottom of the spine, so where the sacrum, the bottom of the spine, meets the ilium, which is the pelvis, you can see there's a little space in there, which is designed for a small amount of movement. Not a ton of movement, but a very little bit of movement. So the sacroiliac joint, when we have pain in that area, essentially that's the name of the type of back pain. And so the key with this type of back pain is there is no way to detect this on an image. So that's the first thing. If you are the undiagnosed back pain where all the images come back negative and you're searching for the answer, this is always a possibility because it's undetectable on an image, which is sneaky. Essentially, these two joints are rubbing together more than they should, and it's causing inflammation or friction. Remember, because joints are two bones that come together to create a space, that space is designed for movement, but if you take away the space, then the joints, essentially the bones, touch each other, the movement decreases, and you get problems. Okay, so the symptoms are really how you diagnose, or not diagnose, but if you can tell somebody is dealing with this type of back pain based on the symptom review or history review. So typically when you sit down, it hurts. When you lay down, it hurts, or when you bend over. But these first two are really common, sitting and laying down. It doesn't typically lead to sciatic pain, which is in the back of the leg. But it does. It can travel down the leg, but typically it's going to go in the groin or pelvic region. So if you're a male, it can be pain or numbness and tingling in the testicle area. If you're a female, in the pelvic region. Again, it wraps around sometimes the lateral thigh, but doesn't travel all the way down the leg. It's common in all ages. It doesn't discriminate versus how old you are. It's very common during and after pregnancy. I should say before and after pregnancy, because of the hormone releases and the laxity of the ligaments that essentially hold that joint together. And usually it's only hurting on one side, and it's a very specific spot. So you can take your thumb and push right on the spot that's hurting. It feels very superficial. Again, how does it happen? It's excessive movement occurs in that joint, and that movement causes friction. Friction equals damage to the cells. Damage initiates the healing process, which phase 2 of that healing process is inflammation. It's important to know it doesn't show up on an X-ray and MRI. The solution is found by reducing the motion in that joint, again, by increasing the motion in the areas above and below the joint. Now let's talk about stenosis. Stenosis has other words, most commonly arthritis or degenerative disc disease. It is not a disease. I hate that name. It's also called spine collapsing, joint space narrowing, or bone on bone. Essentially, what they're doing to diagnose somebody with stenosis is the image, the X-ray or an MRI, is measuring the joint space between the bony vertebrae on the top and the bony vertebrae on the bottom. As we age, that joint space decreases naturally. And so the measurement of how much the joint space is decreased then leads these names to come up: bone on bone, joint space narrowing, degenerative disc disease. And it is because the disc degenerates over time. But that's natural. So I'm not sure how they get away with calling it a disease. So I know you have it. There's a 97% accurate test called a clinical predictor rule, which is based on research. Again, this entire class is based on research. None of it's my opinion. So 97% accuracy if you answer these three questions accurate. Are you over the age of 50? Do you have back pain with standing and or walking? And does it go away with sitting down? If the answer is yes to all these, then there's a 97% chance you have arthritis in your spine. And again, here's a pretty scary picture, but it's just an animation. What ends up happening is as we age, the disc space gets narrow because we lose hydration in the disc. That's normal. It's also why we shrink as time goes on, right? We all know that we shrink. We're shrinking because of this mainly, but really because all of our joints are becoming more narrow. And you can see here that this is where the nerve comes out of the hole, right? But this circle is actually a half circle from the joint above and a half circle from the joint below, or the bone below. And here's the joint of the two vertebrae right here. They slide on each other. It's important to recognize that as this narrows, so does this diameter of this hole. But the diameter of that hole is not fixed, meaning it moves when you move. So certain movements open up the hole, which makes the nerve happy, and certain movements close the hole down. So ultimately, stenosis means narrowing of that hole. So there's three ways to make that hole narrow. One is we can extend backwards. So bending backwards, our lower back, leaning back makes the hole smaller. That can irritate the nerve. If you have stenosis, which if you're over the age of 50, there's a really strong chance that you do have it. We'll get to that in a minute. But it just means you're more predisposed to having the hole close down faster than it did when you were 25. And so that does mean that you have to be careful. And there's certain strategies you do to manage it. But it doesn't mean you have to have pain forever. It doesn't mean you can't move and do anything. It just means you have to be more cautious. It's just like as we age, our skin gets older, and we need to take care of it more than we did when we were 20. So again, the second way to make the hole close down, if it's your right side that you're concerned about, leaning to the right makes the hole close down. And then again, if it's your right side, if I rotate my body to the left, my arms and my upper trunk to the left, that makes the hole close down on the right side. We have a nice animation here that I'll show you. So you can see backwards bending, the hole closes down. The nerve can be irritated by that. Forward bending or leaning forward opens up the hole. Leaning to the left in this case makes the hole close down. But bending to the right makes the hole open up. You can also see the disc space changes as well as we move. And you can see rotation to the left would actually close the right down, and rotation to the right closes the left down. So there's a nice animation of how that would work. Oops, let's see. Let's go back to our slide here. Okay, so we're going to move on to the next one. Okay, so again, appearance of stenosis or arthritis on imaging increases with age. Yet again, most people are asymptomatic, meaning they don't have pain. Here we go. Disc degeneration, which is the same thing as stenosis or arthritis. 37% when we're 20 had it with no pain, and 93% of people when they're 70s have it without pain. So again, we cannot let this be. You don't need an X-ray or an MRI, but if you do have one and you have it that shows you have this, don't freak out. It's a normal part of aging, and it doesn't mean you have to have surgery. It doesn't mean that you are going to live with pain for the rest of your life. It just means that you have to learn some strategies on how to deal with it, which is what I'm going to do my best to teach you. So what's the solution? Well, the solution is, again, found by reducing motion in that joint so that the hole doesn't close down. And that's going to be done by improving motion in the areas above and below that joint. Do you see the trend here? This is the solution for all three of the most common types of back pain. So in a way, I don't really care what type of back pain you have. I care more about the movements that cause the pain or the discomfort, which is what we'll morph into here as we move on. The most common treatment for that scenario of stenosis is what's called a spinal fusion, most commonly. Yet and essentially what they do is they fuse those two bony vertebrae, they open up the hole by bending it forward, and they fuse it open or bent forward. They fuse it with the plate and screws to keep it open. Yet only 50% of people after 2 years after that surgery, they have pain, have less pain. So that means 50% have pain continuing. And what most commonly happens is it's not that the surgery goes wrong. The segment is still fused and still open. It's just that it doesn't move anymore. So now the area above and below that have to move more. And so they're more likely to have the hole closing down. Because it doesn't fix the motion that closes down the hole in the first place. So it just kicks the can to the segment above or below. And then the hole closes down more. So again, the 85% of the time in our clinic, patients come in with stenosis, and research supports this, that physical therapy will help you manage your back pain and get rid of that. So the goal for all types of back pain is to reduce stress or movement in the back itself by increasing motion in the surrounding areas. That's going to be what we cover, and I look forward to teaching you more about that